Texas. Hey, honey.
Hey, this is going to be good tonight. Hope
Oh my
everybody joins
God.
us.
Oh my goodness, I am so excited.
We have a treat for everyone.
We
A
have a
big treat.
treat. Everybody's
Yeah,
coming on. How do you like that? I did my camera. Check this out. I got myself a little space in
look,
the house and my little light.
look at
I
you.
know.
You know what just
Yeah.
happened to me?
Yeah.
I hear this crash upstairs. Now, I
Okay.
live in a gated community, so nobody can come in or out. I hear this crash. So I take a hammer and I
Right.
take my phone and I go upstairs and I'm just shaking and I'm thinking about the movies. Whenever there's someone in the house, they always go towards it, not away from it. So I went
Right.
towards it and I'm creeping up the stairs. I'm thinking, who the hell's in my house? I mean, it was a loud crash. So I was up there about an hour ago, and what it was one of the lights that I use for my videos. It had crashed to the ground.
Oh, geez. Oh my
I swear,
gosh.
Peg, I thought somebody was in the house.
Oh, I bet. Oh, honey. Yeah, we don't even want to go there because,
Oh,
yeah,
it's okay.
yeah, we don't even want to
So,
go there. Hello, everybody. You guys, we have such a great surprise for you tonight. So, Terry and I and Mel, I don't know where he's at. Let's see. We are going to go ahead, Terry. So, Terry, we're going to invite guests on our lives. And tonight, because everybody loved talking about Dr. Coda Reddy, right? Reddy?
well, Dr. Coda Reddy is going to be with us in just a second. And
Yes.
he is probably one of the most knowledgeable doctors I have ever worked with. My brother and I used to have a radio show, and it was actually very popular. It was called What's Up, Doc? And we had invited Dr. Reddy. He is incredible. He is so knowledgeable, and he's going to give insight. He's going to answer questions. It's really a treat for me. So he's super excited. We're going to call him on in just a second. So I hope you guys have your questions ready for Dr. Reddy.
Oh, hi, Scott. Scotty's on. Oh, my God. Hi, Scotty. Scotty is the one that got away. I'm telling you. Yep.
Oh, is Scotty? Do I know Scotty?
No, Scotty's I dated back when Dakota was in the sixth grade. And I
Oh,
just adored this guy, and we've been friends ever since. And I just
yeah,
adored him. We're
yeah.
still friends. Yeah, he's a great man, just a great man.
So we should go ahead and bring on, we can go ahead and bring on Dr. Reddy. So has he punched in yet? He just started his Instagram today. He didn't even have an
All
Instagram.
right, let me see if I can invite him. So it's under, let's see, Coda, right? Coda, ready. Let's see.
There's
Our,
numbers.
so what's his handler? Oh, Coda ready. Oh, here we go. Invite. There we go. Here we go. I hope. Keep fingers crossed, everybody.
He's learning. He's never done this before.
Wow, I
His
can't tell
first,
you. You
he's a
guys, this is a
virgin. He's a
treat.
virgin. He's a virgin Instagrammer. It's his
Okay,
first time.
I hope he gets it. Let's see.
He's pretty sharp.
Yeah, he is. Let me do it again. Coda, ready, invite.
There you go.
Oh, yay!
Is he on?
He is
Yes.
on.
Where is he?
Hello. It is.
Hello.
I
Thank
don't
you.
Thank
see
you
him.
so much for being on. I cannot tell you how much I appreciate you.
He's not on
Thank
my
you.
My
screen.
pleasure. Thank you.
Oh, he's not?
No.
Oh, that's
I'm here.
interesting.
Yeah.
I can see him. Oh, that's wild. That's wild. Here, let me see if I can adjust.
Ah, there he is.
There you
Okay, it
go.
took a minute.
Hey, Doc.
Hey,
Welcome. I'm so excited. I'm going to introduce you, okay?
thank you to
Um,
introduce. Yeah, go on.
so, Dr. Reddy is a cardiologist. He received his cardiology and fellowship at Texas Heart Institute at St. Luke's, which is a big deal. He was the chief interventional fellow. He's board certified in cardiology and fully trained in coronary and peripheral interventions. He's been in practice since 1997. And I love your saying. His favorite saying is treat your food like medication and learn how to use your grocery store as your pharmacy.
That's correct. Thank
So
you.
how long have we known each other?
Pardon?
How long have we known each other?
For almost, 28 years.
Oh my God, that long?
That's a long time.
Very
Oh my
long.
gosh. So we've been talking about you and now you're here in the flesh and I'm super excited. So I've got some questions for you. We can
Okay.
start and then they can ask questions. So what is the biggest misconception people have about heart disease today?
Well, most of them think that, oh, if somebody in the family has heart disease, I'm going to have heart disease as well. Two, oh, my friend dropped dead of a heart attack, so I may have a heart attack. Or three, I exercise a lot, so I don't have to ever worry about heart disease. Or four, I go to the doctor regularly, take cholesterol medications, keep my cholesterol under control, and never have to worry about heart disease, and I can eat whatever I want. And the biggest misconception is that if you can keep your cholesterol down, you will never have heart disease. Problem one. Problem two, I exercise vigorously and regularly, so I don't have to worry about what I eat. That's an absolute no-no. No matter what you eat, if it's bad, no matter how much you exercise, it is not going to protect you from having a heart attack. And you can have perfect numbers and still have severe blockages. It all goes back to one thing, only one variable. What type of food are you eating?
Wow.
Okay, so let's talk about that. Let's talk
Okay?
about what type of foods that we should be eating to help prevent heart disease. And let's talk about what you recommend, what a healthy diet would look like.
Well, the most important thing is try to stay away from restaurants.
Oh, wow. Interesting. Very interesting.
Why?
That's
Because
Most
restaurants
that.
have a lot of
okay,
salt, they have a lot of
most
processed
most
food.
restaurants give you salty food.
Mm-hmm.
Most restaurants cook in liquid fats, and most of these liquid fats are omega 6. And three, they give you fried oxidized foods. So when you eat oxidized foods, when you cook them in liquid fat, and you eat a high salty food, and you are already dehydrated, you are putting yourself at the highest risk for inflammation. The moment you start inflammation, down the road you're asking for mitochondrial dysfunction. And when you have mitochondrial dysfunction, what are you looking at? Cancer, plaque formation, blockages, heart attacks, and strokes. Does anyone want any of these? No. But, oh, I just get up and exercise vigorously and I go out to eat. That's it. Now tell me, how is that going to help you?
So you are what you eat is
Absolutely.
true. So let me ask you, let's say I'm going out to a restaurant. I usually eat salads. I do eat salads, or I'll eat like chicken breast that's grilled. What would you recommend going out to a restaurant? I mean, we all go out to restaurants. What do you recommend as far as ordering off the menu?
Before I answer the question, Peg, what would you do? We discussed this last time.
Oh, wow. Yes, we did. And you told me, you said, okay, this is what you told me, get off all caffeine because I have high blood pressure. And the doctor called me out of the goodness gracious of your heart and get off all caffeine, chocolate, coffee, salt your food at home, but don't eat salty foods out.
Very good.
Stop drinking alcohol. So I did, I took your suggestions, even though I was in Rio de Janeiro for 3 weeks. You can ask Mel. I was really, really good because I'm on high blood pressure medication and I don't want to be on it anymore. I just don't. And I exercise. I thought I ate right, but there's more cleaning up that I need to do. And don't eat out, eat home. That's what you told me.
So let me approach it another way. Imagine ourselves. Each human being is made of cells. That means the unit is a cell. So visualize a cell. It's made of cell membrane. It's got a nucleus. It's got a mitochondria. The nucleus is the gonads of the cell, and the mitochondria is a battery pack. I drive a Tesla. I have a car with a battery pack. If you take the battery pack off, the Tesla won't run. Similarly, if you destroy or damage the mitochondria, can the cell function normally? Now, the cell membrane is the brain of the cell. The nucleus is a gonad and the mitochondria is basically the battery pack. Okay, so when you are dehydrated, what happens to a cell? Does it look like a plump grape or a raisin?
Shrinks. It
It
shrinks.
shrinks. When it shrinks, what happens to the mitochondria? Can it work normally
No.
or is it dysfunctional? It's dysfunctional. Now, when you are dehydrated and your cells are shrunken and your mitochondria are already stressed, now you go to a restaurant, are they going to serve you anything that is with less salt or is it salty? 99%
Salt.
salty.
Salty.
So you're already dehydrated, you go in and eat a salty meal. What happens? How many of us go to a beach and drink water there? How come we don't drink water there? Because it's salty. Well, you're eating a salty meal. How is it any different than drinking salty water? Now, when the salt gets into the system, what does it do? It pulls more water out of the system into the gut. And when that happens, what happens to cellular dehydration? It's worse. Now, there was actually a study which we were talking about. They said, if you're dehydrated and eat a salty meal, it basically blasts and explodes your mitochondria. And do you know how long it takes for them to recover? 2 weeks. And for
Oh,
the next
wow.
week, you're suffering from chronic fatigue. And we just don't stop there. We keep doing this every day and wonder, why are we suffering from so much fatigue? Because fatigue happens when you have mitochondrial dysfunction. So your question was, what would I do if I would go to a restaurant? First, before I go to the restaurant, I look at the menu and look at what I'm going to eat. I never go unplanned. 2, before I leave home, I drink a liter of water. Why? To hydrate myself, because I don't know what my hydration status is. So first I drink a lot of water, and then once I get there, I ask for water. And as I'm sipping, I know exactly what I'm going to order. I'm going to order that and eat. What are the few rules? 1, I make sure that I don't eat anything salty. 2, if I'm going to eat something salty, I'll make sure I'm completely hydrated and I continue to hydrate myself, like he's drinking water. Hi, I'm Kota.
That's
That's my
Mel.
special Kool-Aid. That's not water, Doc. That's my special Kool-Aid.
This is water, Coda.
I love that.
This is water.
Oh, that's even better. Good.
Yes.
So then the next question is, okay, whatever food you want to order. So I was in California, it's an expensive restaurant. So I looked at the menu and I said, look, I want salmon. So he said, okay, good. I asked him, how do you make your salmon? He said, oh, we take canola oil and we what do you call it, cook it on canola oil. I said, no, I want it steamed. He said, we don't do it. I said, fine, I'm just going to eat the salad. I'm not going to eat anything else. Okay, let me go and talk to the cook. He went in, came back and said, okay, the cook said we'll do it. I said, good. Afterwards, he came back and said, we never realized it was so easy, but I got my steamed salmon.
So you're saying that salmon in the restaurant, when they use the oil, is it olive oil? I mean, olive oil is healthy, isn't it?
It's seed oil, seed oils.
I don't know if it is olive oil or not, because any restaurant is always looking at its own budget. Are you going to tell me that they're going to spend $100 to get a bottle of olive oil, which is pure, like your friend who actually has a ranch, he tells me where he gets his olive from. But if they're not going to spend that money, what type of olive oil are they going to use? I'll give you another story, okay? I'll tell you a story. Okay, you make your judgment. This is within my family. My father-in-law is 86 years old. When he was 80 years old, he had a calcium score down. His calcium score was 100. Now remember, perfection is 0. At age 80, if your score is 100, that's very low for someone who lived 80 years of his life and not had any significant calcification of his arteries. Good. So 6 years go by. Now he's 86. At Stanford, they decided to do another calcium score. They did it, and his score came back 1200. How did it go from 80 to from 100 to 1200 in a matter of 6 years when he has not been going out to eat? You know the secret? He's been going to Costco and picking up olive oil, gallons of it, and bringing it back and cooking it. Now, I don't know how much of the olive oil actually has soybean oil. There were reports showing that the olive oil you buy may not be truly olive oil. It may have only 40% or 30% or 20% olive oil, and the rest of it could be canola or soy. I don't know. But how can you explain a person who is at 100 at age 80 has gone to 1200 in 6 years? That means he has been oxidized, eating something oxidized. And what causes severe oxidation? Anything cooked in omega-6.
So
When you cook,
you're saying that the olive oil is healthy. That's why he increased his calcium, right? So
he was
basically,
taking olive oil. But now we're realizing that some of the olive oils in Costco clearly in the back say 70% soybean oil and 30% olive oil, or 70% soybean oil and 30% olive oil. But they're
Yeah.
sold as olive oil. So when you pick it up thinking it's olive oil, but in reality, if you don't read the label and it has soybean oil, now soybean oil is vegetable oil. Vegetable oil, the moment it leaves the company or manufacturing plant, starts to oxidize on the
Oh,
shelf, in the
wow.
bottle, and it continues to oxidize it. Now you cook it with heat, oxidizes even more. So I did an experiment 20 years ago. I never could answer why until now I know. So I decided to, everything I'm teaching you is what I've experimented on myself. So I took an egg and scrambled it in butter. Took another egg, scrambled it in pure olive oil from Central Market. Okay. Another egg, cooked it in canola oil. When I ate the egg scrambled in canola was excellent, very tasty. Could never understand why an egg scrambled in canola oil is so tasty. Now it all makes sense. Because if canola oil is a seed oil and it is already oxidized in the bottle, and when you use to scrambled egg, it further oxidizes itself. The more oxidized you eat, the more tasty it is. The more tasty it is, more toxic it is to you.
Wow. Wow.
So
Interesting.
what about butter versus olive oil? Because Mel likes to cook his eggs in butter.
I would always go for butter.
Mel cooks everything in butter. Everything.
Don't you can't be
Butter's
frightened of
better.
butter.
Is butter better than olive oil if olive oil is 100% olive oil?
So my rule, look, okay, whatever I say here is my opinion and my opinion alone. So please, so okay, I want you to understand that these are my opinions and this is how I live my life. And this is what I teach my patients, whether they follow or not. If you give me olive oil versus butter, I eat butter.
Wow.
Interesting. Very interesting. Very, very
Rule.
interesting.
Well, Peg is a butter fiend.
I love butter. Right.
There you go. So
I
I tell
love
my
butter.
patients, there are two types of oils, liquid fats and solid fats. Say no to liquid fats. Say yes to solid fats. Then you'll ask, what are the solid fats? Butter or ghee, that is clarified butter,
Key.
or cocoa butter, or coconut butter, or the best, beef tallow.
Beef tallow. So basically, and I know you understand this, with the food industry in the United States, I feel it's all about the bottom line. It's about money. Whatever. So what they do is they brainwash us in telling us that this is actually good for us when in reality it is not. What's better is just plain good butter than all of this, avocado oil, uh, olive oil. So they're always brainwashing us because at the end of the day, it's about the almighty dollar. Do you agree with that, doctor?
I am not going there because that is what you call a zone full of landmines. So I am
Okay.
not going. But if you ask me, what would I recommend my patients? I recommend them to eat solid fats.
Okay.
What solid fats? Butter, ghee, coconut fat, beef tallow, or cacao butter. That's it.
But
So
why solid fats though? Why?
Liquid fats, I said you can eat liquid fat, but it's your choice because I don't recommend liquid fats. They say, oh, what about olive oil? I said, listen, unless you know where your olive oil is coming
Yeah.
from,
Right.
I don't know. That's your
But
choice.
but
What about
the so the
what peanut
butter,
oil? That's
but
but rest
the
of them are
butter.
all oils. But if I say I can't go wrong with butter, so that's how I say. Now, what's the motivation and incentive? I don't want to go there.
Okay.
But
Fair enough. That's fair
so
enough.
hold on, Doc. Mel's got a question about butter. Go ahead,
about the
Mel.
butter, right? The butter overall, is it okay for you or is it bad for you
Butter
overall?
is excellent. Because remember, what is the one thing I said? Oxidation. Okay, what does liquid fat do? It gets oxidized much faster than anything else. When you fry something, what are you eating? Oxidized food. When you air fry something, what are you eating? Oxidized food. When you caramelize something, that what is it? Oxidized food. Oxidation leads to inflammation. Second, butter is saturated fat. It is resistant to oxidation. Of
Mm.
all the solid fats, which is the best fat that is least what do you call susceptible to oxidation? Coconut fat. Why? Coconut butter is 92% saturated fat. So saturated fats don't oxidize. unless you take them to very high temperatures. And if they don't oxidize when you're eating them, they're never going to hurt you as long as you're not eating something oxidized. When you eat something oxidized, you're asking for trouble. Yes, it's
Mm.
very tasty, but it's also toxic to your system.
So Coda, so I'm going back to the olive oil things. I eat olive oil every day, but I get it from expensive. I get it. It's from Greece, so it's authentic olive oil. So does olive oil, is it more, if pure olive oil, is it resistant to oxidation as well if it's pure?
Yes, pure olive
Okay.
oil is also resistant to oxidation. Peanut oil is also resistant to oxidation. Avocado oil also is resistant to oxidation, not as easy as the seed oils. But since I do not know if it has or not, seeing my father-in-law's experience, I make it simple because most of my patients are not filthy rich where they can afford $50 to $100 a bottle. So they're going to buy $10, $15 bottles. So if that's the case, I say, you know, you're better off staying away from something that could be adulterated or contaminated. Could be. So why take a chance? Why not make it simple? The simplest
So
way is what?
let me ask you another question. So I don't always cook with olive oil. I just put it in my salad. So it's not being exposed to heat. Does that make a difference?
Let me ask you, okay? You get olive oil from a place, you don't know where it's coming from. You go to a restaurant, you have no idea where the olive oil has come from. And let's say, for argument's sake, it's got omega-6. It's already oxidized, whether you heat
Mhm.
it or not. You're dipping your
Damn.
bread and pouring it on your salad. What are you eating? Oxidized. The more
Wow.
oxidation you eat, the faster you age. Your whole
Why?
purpose
Why?
is
Why does
health,
oxidation
health,
cause inflammation?
not be not accelerate your aging. If that's your goal, then stay away from oxidation. If you want to
Why,
stay away from oxidation,
why does oxidation cause inflammation?
Is a question everybody's asking.
okay, what causes aging? Oxidative damage. Why is everybody taking supplements full of antioxidants? Because you want to prevent oxidative damage to the cell, right? So if you don't create inflammation and if you don't consume anything that is oxidized, you're not going to stress the system. But if you
Mhm.
create inflammation, you stress the system, you cause oxidation. Now you're saying, how can I fight the oxidation, which is causing accelerated aging? Advanced glycation end products. That is when you have caramelized foods and
So
everything that's cooked.
Coda, I'm going to a restaurant and I'm getting a damn salad. What the hell do I put on the salad dressing? Because I always do olive
Lemon,
oil. Lemon.
Butter,
lemon, lemon,
butter.
butter. God, I like this man. I like this
Eat butter.
doctor. I
Eat
like
butter.
this cardiologist.
I was onto something there.
Butter.
You're ahead of your time,
You
Mel.
were
Why?
ahead of your time, Mel.
Yeah.
Explain this to me in your own layman terms. Why is butter bad for you? Why? It convinced me. You convince me, I'll stop eating butter.
No, I always knew
Hold on,
butter. I
doctor.
mean,
This
but
is
someone told me butter won't cause cancer. That's someone told me, and I just said, oh,
No.
okay.
Me why I should not eat butter and then I'll stop eating butter. Give me one statement.
Makes you fat.
It's fatty. It's fatty. It's
Fat.
fatty acids, or
Fattening.
it's an
yeah.
old
All
idea. It's an old
all
idea
fat.
that they taught us not to eat butter. That's an old it's an old belief that needs to be deleted.
But you have still not convinced me why I should not eat butter. You're all beating around the bush, but you're still not telling me why I should not eat butter. I told
Exactly.
you why I eat butter and why I want
Because
you to eat butter. Does
because it
not
has a heavy fat content.
No, it doesn't oxidize. The butter does not oxidize.
That's
So
why
there
you're
that's
supposed
the
to eat
point.
it.
that's butter does
So
not
what's the difference
oxidize.
between butter and margarine, Doc?
Oh, margarine is fake food.
Okay, what is margarine made of?
I don't eat
Tell
it.
Plastic.
I
me.
don't know.
Plastic.
It's got
Huh?
oil in it.
Yeah.
It's hydrogenated
No, sorry,
oil,
Hydrogenated.
not
right?
not
It's a
no,
different
talking about milk.
molecule.
So not margarine. I got mixed up with margarine and mayo. Why would you want
I
to go
don't
to
do mayo.
margarine when you can eat real butter?
Yes.
And a lot of people say, I'll go for mayo. Mayo again is made from olive oil. But again, do you know the source of your olive oil?
No.
Oh, do
Cheap
you know the
stuff.
source of your eggs? If you make it with egg yolks, I'll tell you a story. A 71-year-old Caucasian male came to the office and said, Doc, when I was a little kid, my mom used to boil eggs. And when I was 10 years old, I used to use my fork and cut the egg to pieces and eat it. Now I bought it from the grocery store, I won't say where, in Houston. And after boiling them, I'm having to use a knife to cut it because they're so tough. Then he
Ugh.
asked me, what are they feeding the chicken, Doc? I said, whoa, that's a very good question. What are they feeding the chicken, Doc? So, where is your food coming from? and what has been fed for that product to come to you. Now you start asking those questions. You start becoming very aware which restaurants you go to, what food you order, and what you're going to eat. Otherwise, you put the wrong food in and cause the damage and expect you to be healthy just because you take supplements. It's not going to work.
Not gonna work.
One
So
day, a patient
organic eggs,
I
organic
this
eggs.
patient came to my office, and I did an angiogram on him. 3 of his arteries were blocked, so I put one stent in each of his arteries. And then after that, I would follow him every 6 months. In those days, I used to do the advanced lipid profile. By the way, I've checked more than 350,000 advanced lipid profiles on patients and did reverse engineering, bugged the heck out of them, what they were doing, what they were eating, and all that. So I would look at his numbers. 40 markers, so they're all green, perfect. These were the days when nobody was talking about raising your HDL. I got his HDL to 80. These are the days when I dropped the LDL to less than 20. So he had an LDL less than 20, HDL more than 80, and all his labs were perfect. So 6 years go by, and then one day his wife tells me something's wrong with him. He's more short of breath. I said, okay, we did a stress test last year. It was normal. So since you're having symptoms, let's do another stress test. Guess what happened? This time around, I found that 35% of the heart in the back was not getting blood supply, and the heart was dilated. So immediately took him to the cath lab. Guess what I found? That every artery where I put a stent in, the stents were open, but distal to the stent, there was new disease. So I asked him, his name was Short. This is 20 years ago. He's already moved on. So I said, Mr. Short, I thought you were taking the medications. I know you were taking the medications. Your numbers were all perfect, but you have so much disease in 6 years. So I asked you a question. Have you been eating pies? Yes. Chocolates? Yes. Cookies? Yes. Candies? Yes. Desserts? Yes. Cakes? Yes. Where the hell would you get all these things to eat? Oh, I volunteered at this church. So every time people brought something, I would eat it up. That day I woke up and realized that it doesn't matter how perfect your numbers are. If you eat the wrong food and that's oxidized, it is going to burn you at the stake.
Wow.
What about the butter in high saturated fat? Does that matter?
Butter is saturated fat.
It's high though. It's
And
high in saturated fat. Does it matter on your health?
no, in fact, what I said, what is the best butter to eat? I said coconut butter. Why? It's got 92% saturated fat.
And
Coconut
saturated fat's
butter.
okay?
Yes,
Why? Why is that okay?
because it
Because
doesn't oxidize.
it doesn't
It doesn't
oxidize.
oxidize. So
That's I'm just
what
reading some of the
If you
questions here.
notice, if you notice, even Kennedy said, eat more beef tallow and butter.
beef
So
tallow?
Doc,
Okay, butter.
let's talk about eggs. There's the old adage that eggs aren't good for you. When I went
Okay,
into you,
so
you told me to eat as
yeah,
many eggs as I could. I eat eggs all the time.
yeah. So I did an experiment on myself. I ate 14 eggs a day with yolk for 14 years to prove a point that eggs don't kill.
Oh wow.
I'm still alive.
Wow.
So
Wow.
let me start again. I ate 14 eggs a day for 14 years to prove a point that eggs don't kill. How many
Wow.
people would use themselves as a guinea pig and eat that many eggs a day? The first day when I ate 4, my mind told me, you're going to die. That's okay. I said, next day when I ate 8, he said, you're really screwed. You're going to die soon. By the time I hit 14, my mind was harassing me. You're eating that many eggs, you're going to die. You know why? 45 years ago, I remember reading textbook of physiology. You know what it said? Exogenous cholesterol is not absorbed 85% of the time, 80 to 85% of the time. What does egg have? Cholesterol. Well, does it get absorbed? It won't get absorbed. So if you eat 10 eggs, does the cholesterol get absorbed? Unless
No.
you need it. Or if you're a hyper absorber, that small percent of people are hyper absorbers, so they tend to absorb it. Otherwise, most of us, it's like wax, it just goes through. It doesn't get absorbed. So eating cholesterol does not raise cholesterol unless you're deficient in cholesterol and the body needs it, or you are a hyper absorber, which is extremely rare. Otherwise,
So,
it does not get absorbed.
so there's a question that says, how did you eat the eggs? Fried,
Oh,
scrambled,
I ate them raw, I ate them poached, I ate them soft boiled,
raw?
Rocky style.
Oh, I've heard
So
that eating
I
raw eggs
also
is
Love
not
Rocky
healthy.
style.
I,
I
I
love
was
Rocky style.
I was 160 pounds and I never exercised when I was 55. So I said, let me try this. So I did only two things. I ate 14 eggs a day and I ate full fat kefir yogurt, which I made myself. And I started lifting kettlebells in the office in between patients. I got to the point I was doing 100 pounds 100 times a day, 300 push-ups, bench press, and pull-ups,
Wow.
and all those things. I went from 160 to 185 pounds, muscle and bone, just by eating eggs and yogurt. And I never went to the gym. I use a kettlebell in the office and bars. That's it.
Wow. Wow.
I
Up
can't.
to you're muted, Terry.
Terry can't hear you.
And
Oh,
she's
Hold up.
there you
How
go.
do you get cholesterol down?
Okay, so you have to understand. Okay, first, if you eat a lot of saturated fat, your cholesterol goes up. But again, not everyone's cholesterol goes up by eating saturated fat. There are some who eat saturated fat and the cholesterol goes up.
But
There's
hold on,
some,
Doc. You were just saying that butter is high in saturated fat. So does butter cause your cholesterol to go up?
absolutely.
But then you're saying that butter is good for you. So I'm confused. Help me.
Oh, the rest of the story is yet to come.
Okay.
So
keep
there are some
listening.
who can eat butter and the cholesterol doesn't go up. You know what the variable is? If you have a fatty liver.
Oh, wow.
So
Interesting.
99% of people in this country, including myself, have fatty livers. Why? Because right now, what was I drinking? Coconut. And what does it have? Coconut water. What does it have? Sugar. So once in a while when I drink that, what happens to the sugar? It goes to the liver and becomes what? Fat. Now you have fatty liver. Once you have fatty liver and you eat saturated fat, your cholesterol level goes up. If you don't have a fatty liver and you eat saturated fat, your cholesterol does not go up. That means the key variable that you need to focus on and stay away from is sugar. And
Exactly.
and avoid fatty liver. If you stay away from sugar and avoid fatty liver, then eating saturated fat will not raise your cholesterol as much. That's point number one.
Wow.
Second, what if you decide, okay, we've been told that cholesterol is the bad guy. Agree? Let me flip the coin and ask you a question. What if the cholesterol happens to be the police and the garbage truck and the firefighter in your neighborhood? What is your opinion to them at that point? You want your cops close by, you want your firefighter close by, and you want a garbage truck to show up at your house every week or twice a week to pick it up. Imagine if LDL is that, what happens? Suddenly your perspective changes. When your LDL is high and you have a heart attack, what happens to your LDL within 30 minutes to an hour? It drops. Why does it drop? Why does it disappear from the circulation? Because it's used, it's being pulled, the body pulls all the LDL out of the system to the site of injury to start healing the body. If you go
Wow.
through any major surgery, what happens to your LDL? Drops. Why? Because it's needed. That means if LDL is bad, it should not drop because LDL is needed. Okay, when hurricane hits Houston, what happens to grocery stores? They're all empty. Why? Because everybody comes in and takes it out. Same thing. Now, what does LDL do? It goes to the site of inflammation and picks up the inflammation and becomes oxidized. That's called oxidized LDL. But then what happens to oxidized LDL? HDL comes in and picks it up and takes it to the liver to dump it out. But when you're high on omega-6 diet, what happens? Your HDL becomes dysfunctional. And now here you have oxidation, your LDL is more oxidized and your HDL is dysfunctional, is unable to, and there are no garbage trucks coming to take it out. So what happens? You have plaque. So start looking at LDL as the good guy, not the bad guy.
LDL, the good
Then
What
guy.
your whole,
about HDL? What about
but
HDL?
but then but then you also have to see, is my HDL high enough? Or is my HDL functional or dysfunctional? What am I doing to make it dysfunctional? And am I going to keep my LDL high but eat pecan pies and cakes and desserts and fried foods and cause inflammation? And now if I have a heart attack, who am I going to blame?
So Coda, this gets confusing for a lot of people that might not have a medical background, okay? So to break it down with this HDL and LDL, HDL is supposedly happy cholesterol, LDL is lousy cholesterol. What you're saying is that LDL doesn't really matter. It's the happy cholesterol that needs to be high to compensate. Is that what you're saying?
What I'm saying is stop focusing more on LDL and start focusing on what you're eating that is wrong. And all I'm asking you to do is stop creating inflammation in your system. And what's creating inflammation in your system? Your access to and your what do you call eating oxidized foods.
And give us, we already know about oils, seed oils. Give us a breakdown of some oxidized foods to avoid.
All desserts.
Even
If you take,
lemon meringue pie.
absolutely.
And
What about lemon bars?
lemon bars. That's a joke.
Oxidize,
That's an
That's
inside
a
joke,
joke.
doctor.
What
That's an
about
inside
ice
joke.
cream? Ice cream.
ice cream is also oxidized, but not as oxidized as pecan
Okay.
pie.
So we want to eliminate desserts. What else?
Oxidized food, saturated
Oxidized
or
foods like fried foods.
fried foods.
Okay. What else? Keep going.
What about grilled food? Like grilled
Now,
steak, grilled hamburgers?
okay, let me ask you a question. When an animal eats, a predator eats animal, is it eating oxidized meat or fresh meat?
Fresh.
Fresh.
Okay.
Fresh.
When you go to Papa Steakhouse or an expensive restaurant here or anywhere in this country, what is the first thing he tells you? How many days has the steak been aged?
Days, weeks, right?
25, 28 days. What does
Yeah.
that? What's happening to the steak when you're aging it?
I think
Oxidized.
it's drying it out, right?
Oxidizing,
Oxidized.
oxidizing it. The moment
Oxidized.
the animal dies, you start oxidizing in the body. Now, after 28 days of oxidation, what do? You take it and slab it on a grill, and you further oxidize it with butter. And then you say, wow, this steak is awesome. But are you eating a highly oxidized food compared to what Animal Kingdom eats?
Yes. Yes.
That's all I'm
Highly.
saying. That's all I'm
Highly.
saying.
But what about in moderation though? What about if you
Listen, there is no such thing called moderation. Do you want to hurt your system? Do you want to hurt yourself, hurt your neighbor? Who do you want to do? Love your neighbor, hurt yourself, or hurt him and
Okay. So Doc, here's what we're going to do. Let's break this down. Give us a healthy walk through a day: breakfast, snack, lunch, dinner. Give us healthy options.
it's very simple. Whatever you choose to eat and whatever you want to eat it raw, steamed, boiled. That's it.
Raw,
Raw,
sushi,
steam, or
sushi.
boil. Here, I want
Okay.
to raw, steam, or boiled.
Okay. Raw vegetables. When you go to
Raw.
restaurant, Tori, do you eat salads? Are they raw?
Yes.
Then what's the problem?
Um,
Do
true.
you eat raw carrots?
Okay.
Do you eat raw
What?
carrots?
Yes.
Raw celery?
Yes.
Avocado raw?
Yes.
How is that going to hurt you?
What about meats? We don't want raw
Okay.
meats.
What are the three things I said? Raw, steam, boil.
So you can steam your meat. You can boil your meat. Got
Absolutely.
it. Steam
I
or
just
boil.
had New Zealand salmon. I put in an instant pot, salt and white pepper, and butter on it.
and sous vide as well, right? You can
Huh?
sous vide it. You can
No,
sous
no.
vide
I
it.
just steamed it in an instant pot for 3 minutes. It came out delicious.
And an
3 minutes.
Instapot?
Yes, to steam it. Instant
Steam
pot is
it.
a great investment because you can steam anything, you can boil everything, you can use it for sous vide, you can use it for slow cooking. You can do a lot of things.
When's the last time you had a cheeseburger?
It's been a long time. After realizing what oxidized food does, I've stayed away purposely away from oxidation because this is not the heart you're worried about. The future is coming, and future is what? Dementia. It's coming for all of us. If you don't wake up today, you're going to pay in a big way. No matter how much money you have, you will end up in a nursing home, and you'll be only doing one competing thing: how good is my shit pie?
Oh,
Hey,
wow.
Coda, I want to talk
Wow.
about something else that do you remember when I came in and you did my scan? I had no plaque, and then 4 years later I had plaque, and you asked me what had I done differently, and what did I tell you I had done? You remember that?
Protein bars.
Yes, I was doing protein bars, protein shakes, and blah blah.
Never do that.
Let's talk about that.
Because when you
And
do those, if you, not me, just go and ask Gemini or anyone and about protein bars, protein shakes, protein, processed proteins. Just ask the question, are they oxidized? And if it says yes, then you know the answer.
So
wow.
where does it say oxidized on the package?
No, 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 no. Ask Google, not Google, Gemini
Chat
AI or
Chat
Claude.
GPT.
Chat
Chat
GPT.
GPT.
Ask them to do a search for you, and they'll give you a complete explanation of as what I said is. Just ask a question. Hey, protein bars, the way they are processed, are they oxidized? Simple question.
But we are also talked about protein powder, even the plant-based, and you told me that
It doesn't matter if it's plant or animal
it can
based.
cause inflammation.
That's right. The key is oxidation. If you oxidize your food, you are going to develop dementia.
Wow. This is interesting. This is
Now,
really
now what's the
interesting.
percentage that you will
Told you.
get dementia?
Well,
How high is a
I,
percentage?
I cannot answer that question
About
because
about about. I mean, am I going to get it for sure at some
depend,
degree or later on in life?
no, depends on what your diet is. For example, you might eat an oxidized meal, but rest of the day you eat foods with high in salads and everything else. So you are also consuming a lot of antioxidants in the form of natural food, not supplements. That's actually compensating and neutralizing it because
Okay.
the body has only one goal: to survive. It is not meant or it's not designed to die. It's designed to survive. So it's going to do everything it can to survive. But if your oxidation overload is so high, systems will fail. When systems fail, that's when bad things happen. But if you start your day doing bad thing all day for 20 years, then there's no chance. You will have all the problems you don't want.
I heard a little moderation in that speech right there, Doc.
I never use the word moderation.
I know, but if you're eating
That,
like a hamburger, but I'm
that's
eating
your interpretation of not.
broccoli. I just had broccoli and cauliflower before I sat down here,
That's
but I
nice.
did have like a grilled steak last night though too.
Steam, raw, or boiled. This is what I'm getting. Steamed, raw, or boiled.
Yep.
And
You can take the same steak and make it into a stew with a lot of vegetables and different spices, herbs, seasoning, and make it so tasty that you can't stop eating. But it's just the concept that if I don't grill my steak, I'm going to miss out on everything in life. I
Is
know
that
what.
why? Is that why Asians, because they eat so much sushi, don't have a lot of heart disease?
Who?
a
Asians, the
No,
the
they
Asian culture eats a lot of
okay.
sushi.
Go when you go to a Chinese restaurant. What do? They saute everything, and what all do they use? Soybean oil. When they use soybean oil and saute it and
But not
stir
in
fry.
sushi. In sushi, sushi's raw.
Okay, sushi is different, but
Yeah.
just don't eat sushi. Even Copper Masa, when I go to New York and eat the place, it's an expensive place. But again, half the dishes I eat are oxidized.
How is sushi oxidized if it's raw?
Not sushi. The menu has, along with
Oh
sushi,
no, I don't. Yeah, it's and it's also got all that stuff in there.
yeah,
Yeah.
sushi and
MSG.
sashimi are some of the low on oxidation level. I'm not denying that, but you just don't eat sushi. I'm more of a glutton, so when I go, I eat a lot. I don't eat little. I eat a lot. So when I eat a lot, that's not sufficient. I want more, so I keep eating. But
So
then some are
you,
oxidized anyways.
you have great skin. I know that. Tell everybody how old you are.
63.
Yeah, you've got great skin.
Thank you.
Wow.
Practice what you preach. So let's talk about, if we can, this peptide rage. What is your opinion? Do you see that coming like into the forefront, or are you concerned about it, or what are your thoughts?
Um, I have opinions about them, but I may be wrong. That's why I tell people if they want to do peptides, the one thing, okay, before you do anything, I'll teach you something. Before we answer the question, a 93-year-old lady came to my office and said, I want to do your diet. I looked at her and said, you're in a wheelchair and you have multiple problems and you want to do my diet. Why would you want to do it? She said, no, I want to do your diet. I said, okay. So I wrote down everything, what she needs to eat and what she should avoid, and gave it to her in two pages. She stuck to it. Within 14 days, she got rid of all her 14 medications. She went on to lose 50 pounds, 60 pounds the first 100 days. She got out of the wheelchair. Now remember, when you're in a wheelchair for 2.5 years to get off, it's not easy. It's like a 6-month-old child learning how to walk. She got out of the wheelchair, started walking with a walker, then with a cane. Then at 96, I have a video of her climbing a flight of stairs. She would take the bus to rehab and come back on her own. She lived to be 97 without medication from 93 to 97. And if anybody has any doubts, they can go on to YouTube and Google Kota Reddy and Dorothy Graham, and you can actually see the video of her progression from 93 to 97. And she lost 160 pounds. What is the moral of the story? Even now, if you change, you can let the body heal. And once you let the body heal, you can avoid all the problems you don't want to have.
What about coffee?
Well, okay, I'll tell you another story. One day, a person came in and said, I got off your program. I said, doctor, I got off your program, Hispanic gentleman. I said, if you got off my program, it's like if you get off the wagon, jump right back in. What's the big deal? So, oh, you don't understand. I almost died. I said, what do you mean you almost died? Oh, I was in the hospital for 3 weeks. I had a big blood clot in my leg that went to my lungs and almost killed me. I said, okay, so listen, you're 66 years young. If you have a blood clot in your leg and went to the lung, that means it's not genetic. You did two things wrong. You were dehydrated and you did not move. So I said, tell me. He said, October 30th, the night before we were watching Astros. Okay, did you drink alcohol? Yes, I drank alcohol. You and your friends. Did you eat anything, cheese and chips and nachos? Oh, yes, we did. Good. Did you drink water? I don't remember. Good. I know. When I have scotch and cheese and scotch and other stuff, I don't drink water. And I have to force myself because for some reason your thirst center goes down and you don't drink water. So next thing I know, I asked him, okay, what did you do in the morning? I got up and had a big mug of coffee. Good. When did you have your blood clot? At 2 o'clock in the afternoon. Why would you have a blood clot? Because
Dehydrated?
severely dehydrated. What are the two rules? If you're severely dehydrated and you are not moving, you're going to cause a blood clot. Hey,
Hey,
don't
Peg.
drink much water because when you drink that much water without electrolytes, you're going to have problems. So always go on Amazon and order Light, Lyte, or Elite, and add the drops to the water and drink. That way, when you drink a lot of water, you don't drop your serum. So I did an experiment on myself. I would go to work, I would drink almost 4 glasses of water, and by the time I go to work, I'm dizzy. I can't focus. I've got lightheadedness. I'm not able to communicate properly. And by 3 o'clock, my symptoms would disappear. Okay, so one day I said, let me check my blood. I checked my blood. My sodium dropped to 129. And then by 4 o'clock, the sodium came up. That's when I realized when I was drinking that much water, I was diluting my sodium level, so dropping it to the point which was causing me to have headache. Had I continued to drink like that, what happens? The sodium drops. How do I know that? A patient came and said I had 3 seizures. I said, okay, what was the common denominator? They said my sodium was low. Okay, this guy was drinking so much water that he dropped his sodium to 110 or 115 and started having seizures. And the third seizure, he almost chewed his tongue off. I said, look,
Jesus.
every time you drink water, so my rule is simple: eat salt, avoid salty food. If you're
I
going to eat
told you.
something salty, stay hydrated and drink water as you're eating.
What about drinking water before you go to bed?
You can, but if you do that, there's a good chance that you might get up at night to pee. That's all.
That's it?
So,
That's not a good thing or a bad thing?
It's a good thing because remember, most people don't drink water and go to bed. Okay. And let's say they, on an average, they sleep 8 hours. So they did not drink water. They're already dehydrated. They go to bed and they sleep for 8 hours and they get up. Are they dehydrated? Yes. Severely? Yes. Then what do they do? Drink
drink
coffee.
coffee.
And what does it do to you?
Dehydrated.
Dehydrate you.
So
Dehydrated.
Caucasian lady comes to my office. She's 44. She's sitting in a chair like this with the head back. And the husband says, look, 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 look. The skin doesn't come down. It stays up. I
That's
said, dehydration.
dehydration.
And the treatment for
Dehydration.
dehydration is drink water. Oh, she drinks a lot of water. Now, how can I argue or talk to someone who says she drinks a lot of water? So she's a new patient. So I walk out, I look at the notes and look in the back. It says she drinks a gallon and a half of iced tea. That means she's peeing 3 gallons a day. No wonder she went to the ER 3 times in 6 months with severe dehydration.
Coda, does tea dehydrate you as well?
Yep. So
So
I took my team to Las Vegas. So
Woo!
that's where
this was
Peg
15
lives.
years ago, and my nuclear tech, and my accountant, we stayed in a suite. So I got up in the morning as my ritual is to drink a liter of water. So I drank a liter of water. And these two bozos run down quickly and come back with mugs of coffee. So we are sitting there discussing politics for the next 2.5 to 3 hours, and they finish their coffee, and I'm waiting and watching. Each of these two went to the restroom 3 times in 3 hours, and I have not. So I tell them, I drank a liter of water. We ate the same food, salty food. You did not drink water. You drank coffee. You went to the restroom 3 times, and I'm still waiting to go to pee. Who is more dehydrated? Now answer the question.
The
Doc, what
person who
about
urinates more is more dehydrated because you're getting rid of it.
And
So
that's
you're
because
getting
pain, it makes you more dehydrated.
correct. Okay,
Doc?
got it.
Doc? What about drinking occasional beer and occasional wine?
Look, Occasional is not a problem. Occasional is not moderation. Moderation is you're doing it 3 or 4 times a week. No. Occasional, not a problem. Do whatever you want. It's not going to hurt you.
Wow.
Okay,
Patient comes,
let's get on
50,
to this.
50-year-old Caucasian male, no family history, everything's perfect. And we did tests and found that he had 99% blockage in the neck. I said, 99%. I said, listen, have you been eating a lot of fried, roasted barbecue food? He said, Doc, I have 6 barbecue pits in my backyard and I sell barbecue pits for a living. I said, that's the reason why you have such blockage in your neck artery and you severely plugged yourself. Now, he doesn't eat, he sells it, but he doesn't eat anything. It's
Can
been
you
almost 6
reverse the calcium in your neck? Can you reverse the calcium?
Once you form calcium, that is dead plaque, it is never going to be reversed. It's like going through a cemetery. So whenever you see a calcified plaque in your artery anywhere, that is dead plaque. Once it's there, it's going to be there forever. But dead plaques don't hurt. It is the non-calcified plaque that is adjacent to a dead plaque that can explode and give you a heart attack. For example, there are 6
Jesus.
variables.
He's a
If you
genius.
respect sleep, if you take on too much stress, if you eat oxidized food, if you eat late at night, if you stay dehydrated and you travel, you have plaque formation in less than 2 to 3 weeks. And those plaques explode and cause heart attacks. That's why in this country, every year there's a 40% increase in heart attacks in the last 2 weeks of December and first 2 weeks of January. Why? Halloween, Thanksgiving, Christmas, New Year. What is everybody doing? Traveling, partying, eating late, eating a lot, drinking a lot
Drinking.
of coffee, drinking a lot of alcohol, causing dehydration. All these 6 variables. Tim Russert, 24 years, 25 years ago, Tim Russert, famous TV anchorman, what did he do? He went to a cardiologist like me, got all the workup done, completely normal. His total cholesterol was 120 on a cholesterol medication. Total was 120. That means bad was around 30. Goes to Italy for 6 days. Eats. Day 7, he flies from Rome to New York. Day 8, he walks into the boardroom, the plaque explodes, he drops dead of a massive heart attack. Was it genetics? No, because his dad was still alive at 84. Was it high cholesterol? No, he's taking medication to keep the cholesterol under control. Did he not get himself checked? 6 weeks earlier, he got all the tests done which were completely normal. Yet he had a plaque rupture and a heart attack and dropped dead. That's where these 6 variables, if you don't pay attention, can hit anyone.
Dear
So
God.
the calcium's if the calcium's there and it's dead, will it cause blockage?
That depends on if you continue to form blockage. You can have a 20% plaque that is calcified. You can have a 30% plaque that is calcified. You can have a 70% plaque that is calcified. Or you can have a 30 or 60% plaque that is not calcified, but that could explode and cause a stroke. You could have a 70% plaque, which is full of necrotic stuff, and that explodes like a volcano. That can give you strokes. So there are many variables in there. So the question you have to ask is, how tight is the blockage? And what is the consistency of the plaque? Is it soft? Is it firm? Is it hard?
Wow.
Yeah.
I am
Well, let's.
recording. Hold on, Terry. I am all our listeners out here. We've got a lot
That's
of
what I was
questions.
going to say.
I am recording this, and yes, I will post it because this is a lot of information, and this is something that I will be listening to again over and over. So
Can
thank
I
you,
make
doctor.
can I tell you something?
Yes.
In the next 10 days, I'm launching something called askmydoc.com. It is $9 a subscription per month, but it's completely all my philosophy, what I've learned in 30 years, and access to 600 videos. And it's AI that answers all your questions and tells you what you're doing wrong, what's wrong. It's AI
What
driven.
about gold? What about golden discounts?
You know, Benjamin Franklin, when somebody asked him, "Can I get a discount?" he raised the price by 50%. So for you,
Perfect.
it's $20.
Perfect.
But
Doctor, I can't.
you're gonna come back on this show. You're gonna
If you
come
invite
back
me,
on
I'll come
our
anytime you want me to come.
Doctor,
anytime.
I'm flying down just to see you, and I'm going to make an appointment with you because I want to get off of my high blood pressure medication. And I don't want to be on it anymore. I just don't. And I will do whatever it takes to get off of it because I know intuitively it's causing me more harm than it is good because it's masking what I really need to be doing.
Because if your blood pressure is high, the first question you have to ask is, what is my blood pressure at home? Never trust the blood pressure in the doctor's office. Rule
Right.
2, always check it at home. Rule 3, it should be less than 120. Rule 4, if it's more than 120, you're risking shrinkage of the brain. Why? I have pictures in my office. When your blood pressure is less than 120, your brain looks flush with blood supply. When it's more than 120, it looks pale. That means it's causing vasoconstriction. Now you drink caffeine and your blood pressure goes up. Caffeine, by the moment it gets to the system, drops your blood supply to the brain by 40%. Okay, that's the second problem. Third is, if your blood pressure is high and you're decreasing blood supply to the brain, what will happen? You're looking at dementia. I'll give an example. A friend of mine I called him and say, hey, what are you doing this weekend? He said, I'm going to New York. I said, why didn't you tell me? I could have joined you. He said, no, I'm going to meet my family. I said, is it a family reunion? He said, no, I'm meeting my cousin. I said, why? What's the big urgent? Oh, she's going to a nursing home. I said, what? How old is she? At that time, 62. I said, that's my age. And she's going to nursing home. Oh, he starts laughing. Her blood pressure is high. It was 150, 160. The Primicin didn't do much. And now she has dementia. But nobody's connecting the dots. Blood pressure, then what is the right blood pressure? Should be less than 120. Goal is to be less than 120 without medications. But if you're needing medications, you have to ask, what am I doing wrong? Is it sleep apnea? Is it stress? Is it caffeine? Is it daily alcohol? Is it salty foods? Is it kidney issues? Is it adrenal issues? These are the usual 7 variables. There are other variables, but they are extremely rare. I have sleep apnea. I use a machine. I don't drink caffeine. I don't take stress. I don't drink alcohol. I eat salt, avoid salty food. I stay hydrated. I don't have issues with kidney. My blood pressure is 110 without medications. And I have a lot of patients who have corrected these problems and gotten off the medications. But the key is,
Why
how
is your
many of
blood
them are
pressure so
willing
low? Why is it so low? Tell me why your
the
blood pressure
pill?
is so low.
Everybody wants a pill to correct the problem, but nobody wants to make the adjustments or changes in life.
True,
So
but
if
why
you
is
do
your
the
blood
change,
pressure
you'll see the result.
110? Why is it
Pardon?
110? Why is your blood pressure 110?
I'm pissed it's 110 and not 90. Because the lower the upper number, the more protective it is for the brain.
But why?
So Mel,
What's the number one thing you think that brought your blood pressure down below 120?
No, my blood pressure used to be 90 until I turned 50. And then it went up to 110, 120,
What
130.
keeps
Then,
it low? What's the number one thing you think that keeps it low? Number
oh,
one thing.
sleep apnea. I use the machine and go to sleep. And there are times I sleep 12 hours. I'm happy. And I sleep, I get up, my blood pressure is normal. Second, caffeine. Patients who give up caffeine, they say, Doc, I never realized I gave up caffeine, my blood pressure dropped by 30 points. There you go again. Third,
okay.
eat salt, avoid salty food. The moment they understand, hey, what am I getting food from outside? Why can't I do it at home? And once in a while go out. Why do I have to order out or Uber Eats and eat the food and raise my blood pressure? I'll tell you another story. A 50-year-old Caucasian nurse called me and said, this was at a time when I was in Las Vegas. She said, oh, I'm going to the ER. I said, why? My blood pressure is 220 by 120. I said, good choice, going to the ER. I said, you must have eaten something salty because I know she was not doing anything else wrong. She said, I don't eat anything salty. So that's fine. She spent 3 days in the hospital. Then she calls me and says, guess what? After we discussed, I went back and started asking questions. What was I doing wrong? For the last 1 week, I've been cooking with beef bouillon cubes. I said, whoa, that explains. That day, I also learned when you eat salt consistently, suddenly your blood pressure goes up. You know, it took her 1 week for the blood pressure to come down.
So
So
Coda,
don't mess with salt.
so Coda, decaf
Wait,
is
hold on,
de-
Terry, hold on. Doctor, when you and I spoke on the phone, you said it was okay to salt my food at home, but don't eat salty food out.
That's right.
So can
Because
you
I
explain
always
that a little bit
eat
more
salt. That means when you're cooking something, finish the cooking and add salt in the end.
in the end?
There are 2 types of cooking. One, they throw in salt when they start cooking. I say no. Throw in everything you want, cook, and then before you eat, add salt to your liking, and then drink water before you eat. That's it. And salt will never bother you.
Okay, thank
Okay,
you.
look, I got a question because someone asked it and it went by. GLP-1. What's your thoughts on the GLP-1?
Well, I'm not going to tell you what my thoughts are. I'm just going to present the problem. You decide what you do. How does GLP-1 work? It decreases your desire to eat, and it slows down your gut motility. Let's say you are on GLP-1 and you decide to go for surgery. What is the first thing the anesthesiologist asks you? Are you on GLP-1? You say yes. Then what does he tell you?
Yeah.
Stop it for 2 weeks before you come back. Why would he say that? I've had patients, spouses tell me, when my husband burps, The food he ate 12 hours ago, it is rotten meat. I can smell it. The whole
It
room
affects
stinks.
your gut motility.
And when your gut motility is slowing down, most of these people complain of dizziness. Why would they complain of dizziness?
Digest.
Because why? They drink coffee, but they don't drink water because they are not thirsty. Next, if your gut is not moving and the food stays there for a long time, is bacteria growing? Yes.
Yes.
If that happens, are you going to take omeprazole or something to help with acidity? Yes. When you take the acid off, will the bacteria grow even more? Yes. Can that go in the future cause small intestinal bacterial overgrowth? Maybe. What if it does that? Are you willing to live with that? And constipation. Can it cause constipation? Yes. If dehydration and constipation are going to be hand in glove, what did I learn in my practice? 98% of medical problems happen because of dehydration. Constipation, dehydration, hemorrhoids, dehydration, hernia, dehydrations, blood clots, dehydrations, heart attacks, dehydration, strokes, dehydration, cancers, dehydration, dementia, dehydration. All of these are linked to dehydration because of mitochondrial dysfunction. So, what are you guys doing? Dehydrating yourself for
Drinking water.
no, not you.
But
I'm just
but hold on, doctor. I want to get the electrolytes that you suggested because it's not just about drinking water, it's adding the electrolytes that you
it's
need.
called elite or light. ELETE, elite or light. I prefer light because it also has some citric acid, makes it the lemony flavor and makes it easier to drink.
So
What about trace
light
mineral? The
drops,
trace mineral product.
You're
light
wasting
drops off Amazon.
trace
Light.
mineral product, you're wasting your money. You're,
Why?
you don't need it. You get all those minerals from everything you eat. Let me ask you a question, right? Everybody is loading up on vitamin C. Well, before World War II, when people were doing seafaring adventures and all that, you'd see scurvy, vitamin C deficiency. Even during World War II, some of the prisoners had vitamin C deficiency. Now, in the last 50 years, including Africa and Somalia, have you ever heard one case of vitamin C deficiency? Why is that? Are we that deficient that we are popping pill after pill after pill for vitamin C? Tell
So
me,
the, I, wa-
if there's one patient with vitamin C deficiency in this country, it will be national news. Have you ever heard of that?
no, but I want to go back to GLP-1 because it's such a big thing. So you would never prescribe GLP-1 to your patients, is that correct?
No, because I'm a specialist, so I don't have the capability of prescribing. If a patient asks me, I have a primary care in my office, I tell him, go and talk to my primary care, and if he decides, but that's between you and him, because I
But
cannot prescribe.
your thoughts on it is basically a no-go.
I just gave you the information. You decide what you want to do.
He just gave us the facts
I know.
about the whole
I
right.
know.
So you
And
make your
then
own
Hey,
decision.
every fact
you're
was
like a
bad.
lawyer. You're like a lawyer asking me to commit. I'm saying this is the facts. You decide. If you're my patient and say I want GLP-1, I'm not going to say no. I'll give you the facts. I want it. Here's the primary care physician. Go ask him. Take it. I'm not prescribing. So, but I'm not. I only tell you data, and you choose. It's a free country. You have a choice.
There you go. There you go.
Okay, so Doc, decaffeinated coffee is decaffeinated okay? I mean, it doesn't. It has a little.
It's definitely better than caffeinated.
Excuse me, sir. What did you say, doctor?
It's definitely better than caffeine. The less amount of caffeine, the better off you are.
Okay, and
So
that's because you told me also, doctor, to get off chocolate because I love my dark chocolate. I love it, and you said get off of all caffeine.
Because the point is, I want you to get to the point where your blood pressure is normal without medication.
Thank
Now,
you.
then you start introducing and seeing, okay, it went up. Okay, you know what went up? Why it went up? Because I did this wrong. First, knowledge is power and know where you are. Two, see if it works by changing your lifestyle. Once it works, then you start introducing and say, hey, now, hey, I did this. That's why it went up. I better not do it. Because at the end of the day, nobody wants to go to a nursing home.
you
Doctor,
were talking.
wait, Terry, I am committed. Everybody out there, I am really committed, and I'm going to fly to Houston to see you because I am committed to get off of this medication because I do not like it. So I'm going to follow. And Mel, when we were in Rio de Janeiro, I mean, I did pretty well. I really did. No,
But
caffeine, no chocolate, the salt. And, but I want to, my pressure is still high, even on medication. So there's some things that I need to change and I need to do differently.
the other thing also you need to look at is your size of the red blood cell, MCV.
Okay.
I'm picking up a lot of people with increased size of the red blood cell. And that's a sign that your B12 levels are low. And most of the people either are low in B12 because they're not consuming foods with B12, or they have gut bacteria which is eating it up. Like in my case, I was eating fermented foods. I was eating kefir yogurts. I was eating goat liver, beef liver, pate, liverwurst. I was drinking green smoothies. I was doing all those things. These are all loaded with B12. Yet my B12 was 320. You know why? It's not because I'm not absorbing. It's because I have a certain type of bacteria in my gut from wherever you acquire it. Because whenever you go eat outside, you know what you're getting. And that is eating up my B12. And no matter how much I took, it would not raise my B12 level, which in turn was causing me to have increased red blood cell. That means whenever your red blood cell increases in size, that means your nucleus is increased in size. That means your nucleus is full of immature DNA. If that happens, the same thing happens to your brain cells. And that's the first sign that you're heading towards dementia.
Dang.
What
Wow.
what about the cardiovascular, workouts like running, riding the bike, things of that sort? Do you recommend all that? High levels of it?
Yep.
Okay, like what about resistance training?
Absolutely. There are 5 things I recommend to my patients. One, stretch. Stretch more than climb. Climb more than walk. Walk more than sprint. And sprint more than lift weights. But you have to do all these 5.
Wow.
So, my turn. Got a couple of questions.
Okay.
Peg, has Peg been checked for sleep apnea?
I'm skinny and I have sleep apnea. You don't have to be fat to have sleep
No,
apnea.
has Peg been checked for
No,
sleep
I
apnea?
have not. I have not. I have not. Not
But
You
properly.
should.
because, so in dentistry, one thing that we do with our patients is we can check for sleep apnea. And sleep apnea is so common, people don't
Yes.
understand the effects it can have, and it can shorten your lifespan. It also contributes to high blood pressure. So a lot of times when people have high blood pressure, it's contributed to their sleep apnea as well. And it has to do with the jaw position. There's so many ways that you can correct it. You can correct with oral appliances instead of doing the sleep pat machine, the CPAP machine. But it might be something, Peg, that you might consider getting checked out.
Oh, I will.
It
Yeah.
100%.
is right.
I'm gonna, yeah.
Because my blood pressure is 110. You've checked me. It's 110 over like 60
No,
something.
you are perfect. You don't have any calcium in your arteries. Your blood pressure is perfect. Everything was correct. But also remember, somebody wrote a comment saying that interesting sprint more than weightlifting. I am not belittling weightlifting. I'm saying you have to lift weights. I'll give you an example. When my father turned 78, he came to me and said, I was in California at his house. He showed me and said, look, my doctor put me on this medication, injection every week to help with building bone. I said, do not take it. He said, what should I do? I said, hire a trainer and start lifting weights three
Hmm.
times a week. So he's a man of principles, so he decided to do it. Guess what happened? When he turned 84, they did another bone scan. All his negatives became positive. So around the same time, I was at his place, and then I'm picking up the suitcase, taking it from the bedroom to the garage to put in the car. So I'm walking by the kitchen. It's already heavy, so I put it down for a second. He comes up to me and says, why, is it heavy? I said, yeah, it's more than 65 pounds. He stands next to the suitcase. He's 84 years old and is strict vegetarian. He puts one arm there and lifts the suitcase with one arm. I was impressed. That's how much muscle he built by going to lift weights 3 times a week. And he got a good trainer who would work with him and push him. And not only did he build muscle at that age, but he also built bone. So the point I'm trying to lay is, I'm not saying don't lift weights. I want you to lift weights, but I want you to focus more on other things. Like, for example, stretching is important. We never stretch. That's why I said stretch more than climbing. Climbing is very important. Have you ever noticed when you climb a flight of stairs, how much of your brain has to be involved compared to walking?
Hmm.
Then third is walking more than then of course sprinting. But you can't sprint for a long time. A lot of times when you sprint for a long time, you hurt your ligaments. And of course, lift weights. Why? You have to lift weights to build bone, to build muscle. I mean, build muscle to build bone.
Real bum. Wow. Okay. So we're gonna
This
put
was
in.
so good.
This was
This was
so
so good.
good. So I can't tell you. Thank you so much for coming on here and talking to all of
And
us. We're gonna put all.
what's your launch again? What's your launch of your product?
It's
We're gonna put
Ask
that in the
My Doc.
comments after this.
Tell
Excuse me,
Ask,
tell us.
doctor.
Tell us.
it's called askmydoc.com.
Okay. When's that
It,
launching?
it, it's a completely AI driven. and it's going to answer every question you have the way I answer it and my philosophy. And if it's unable to answer, I get the question, I create a video or this thing and put it back. So it continues to evolve. And it's already got a lot of information because for the 30 years, what I've been doing and talking about, it's all going to be there. Plus, it has the ability to think and learn and grow.
Oh,
Great.
great.
We're going to put all of this in the comments, you guys, for everybody out there, because there are so many people listening right now, Doctor, and I can't tell you thank you so much. All the information will
Thank
be there, and your upcoming program will be there. And I want to see you personally in probably a couple of weeks. And I'm telling you, I will be
You're
your,
not going to take me with you?
okay, if you want to come.
And I'm going to
both
schedule
of you can come,
my
Terry, as
annual
well
with
for the
you.
sleep apnea.
I'm
Yes.
scheduling my annual with you, Doc.
Yes. So I will see you soon. Thank you, Doctor, so much. I
And
cannot tell you
Terry,
how much
Yes,
we
thank you.
appreciate this.
thank you for
We'll have you on tomorrow as well
ah,
for follow up.
okay.
We will
He'll
have
come
you guys,
back.
after I do this for a while and change the things that I need to change, we will definitely have you back, Doctor, and we will have all of my results. Definitely. So I appreciate it so
Very
much.
good. And thank
Thank
you for
you.
asking those good questions.
Yeah,
Thank
thank you
you
so much.
very,
Thanks
very
for your
much.
Thanks,
time.
Thank
Thank
you.
you
Coda.
so
So,
much.
are
Thank
you
you,
going
Much
to
Doctor.
appreciated.
stay away from oxidized foods?
Oxidized
Yeah.
food. Drink water with
I'm going to
electrolytes.
go buy me some butter tomorrow.
Remember,
Yeah, right?
butter, beef tallow, coconut butter, ghee, and cacao
Ghee,
butter.
cacao.
Last rule, which I didn't say. Eat fat. Don't cook in it. That means don't heat it. Eat it, don't heat it. You see the point? Eat as much
Mhm.
fat as you want. Don't heat. That means if you take
Avocados.
Eat
eat
it,
Yeah.
don't
avocado,
heat it.
if
Write
you
that down, Terry. Eat it, don't heat it. Boil,
if you
steam. We're going
yes
to put all this
if
down. Boil,
if you
steam.
cook in butter, butter doesn't get oxidized, but it's going to oxidize the food you're cooking in because it raises the temperature. One last thing: stay away from air fryers.
Yeah, that's bad. I heard that. I don't use them.
Hey, Coda, one quick thing. I eat a lot of popcorn without salt or anything, just plain
My
popcorn.
first question, if you ask me, is popcorn oxidized? Yes, a little
No.
bit. Yes, a little bit, but it's not. Is it that dangerous? No, you can eat it. It's not.
Unless you break a
Not.
tooth.
It's not oxidized like the other foods which are severely oxidized.
So here's a one last question. So if I need to know if a food is oxidized, I can go to ChatGPT and I can ask, is this food, is this product oxidized? And if it is, stay the hell away from it.
Right. There was a question saying that why air fryer? Ask yourself, air frying. It's actually
Right.
more toxic than oil frying. If
Yep.
you think oil frying is bad, air frying is even higher. So if you really want to make your physicians rich, fry everything and eat.
Yep.
I want
Amen.
to, I want to know how many people after this reel are going to go clean out the refrigerators and clean out their pantries.
I am. I am. I am. I want to live long, but I want to live healthy. I don't want
If
to
you
live
want, if you
long.
want to, if you want to increase your health span and lifespan, one word: oxidation. Don't oxidize your system. That means don't eat anything that is oxidized. Don't drink anything oxidized. If you don't do that, 90% of the battle is already won. And stay hydrated. It's so simple.
Right.
But what
Thank
do? We are dehydrated and eat oxidized food and salty food. Then expect miracles. It's not going to happen.
Okay. I'm going to be a good tester because I have really high blood pressure. So this is going to be a good, for everybody because it's high, even on medication. So thank you, doctor, so very
Thank
Thank
much.
you. Thank you.
you.
Thank you.
You.
Thank you.
Thank you.
Thanks for your time.
Thank you
Pleasure
very
all mine.
much, doctor. Thank you.
All right, guys. Have a great evening.
Thank
All right,
you.
everybody. Well, I'm going to put this out on my page. So we recorded it. So all this information will be
And
out
it'll be
there.
on mine as well.
And
Thank
Terry's
you,
and
ladies. Yeah,
Mel's,
and
and
Mel's.
we took
Yeah.
notes. So we're going to put all this out there, you guys. Thank you so
So
much.
bye, Peg, bye, Terry, and bye, Meg.
Thank you very
Bye.
much, doctor. Thank you.
Bye. Good
Bye.
night, guys.
Bye.
Boy, was that good, was
Oh
it
my
not? I told you
gosh.
he is an encyclopedia.
Amazing.
He
Yeah.
I'm
just
going to,
he knows so much information.
honey,
Well,
wait. So really quick. So Mel, honey, when you cook for me, it's boiling, it's steaming, honey.
no,
And what else did he
no,
say? Boil,
no,
steam,
no,
Raw.
raw.
no,
Yes.
no,
Yes.
no,
Yes.
no.
Yes.
You
Yes.
yeah, cook on your own at that point.
No, stop it. You
No,
want me to
I'm
live
not doing
healthy
that.
and long?
I believe everything he says, but I'm not going to do everything he says.
Well, it's hard. I mean, that's living in a
Well,
Yeah, I'm
here's
ideal.
not
the
doing it. I'm not
you
doing it.
don't have to because you're
I'm
really,
not
really
doing it.
healthy. I have
Well,
to. I don't have a
my
choice.
blood pressure is, like
Right.
it's over 120. It's like 125 or something, right? And he wants it down to like 110.
Mine's 110.
Mine's 140 on medication, you guys. So I got
Yeah,
it.
I
I
mean,
don't have a
you
choice.
know,
I don't have a choice.
Now my
I don't know
pulse
how
is
to cook
40.
that way. So
My
I just
pulse is
I'm not
50
doing that.
something.
I just don't
My
I don't
pulse
do
is
that.
50. You can get your blood pressure down, Mel, by eliminating alcohol and fatty stuff. You can do
I don't
salt.
do that. I before I came on, I had broccoli and cauliflower and hummus. That's what I had.
Well, look, you guys, the bottom line is we can all make adjustments. You know, you guys are talking little tiny high blood pressure. Give me a break. You do a little of adjustments, it definitely would come down. I do have to get in there and do some
Did he
hold
talk
on. I
about
have to
how
do
much
some
of it was
radical,
genetics?
hold on. I have to do some radical changing. Go ahead,
I,
honey.
but did he say how much of that was genetics?
Yeah, what he said was that a lot of times someone dies of a heart attack, nobody in their family, or if someone has died of a heart attack, you don't necessarily, it's not necessarily going to happen to you because it's the way you lead your life. Let me give you an example. My parents both were overweight as they got older. My mother had a kidney transplant, she had diabetes, and my dad had high blood pressure. I have nothing that my parents had. And it's the way that I have lived my life since I was growing up. I was an
Mm,
athlete growing up. I've always watched what I eat. So what he was saying is you can control that. So just because your parents might have passed and had something doesn't mean you will. Now
right.
the
Yeah, I
propensity
mean,
is
I understand that, but I can't give up, my lifestyle. But I'm already doing as much as I can to be healthy, but not to give up, a grilled steak or, I
well, I
make
don't
soup
think
all
you
the
have to
time.
give up a grilled steak. I think it's everything. Just don't like. I like chips. So every now and then I have chips. Big deal. I'm gonna do. I'm not gonna just live in this like idealistic diet, but I'm gonna do the best I can. And I
Right.
think
I
Yeah,
mean,
that's fine.
if we all clean up a little bit, I think it's, right. If we all start cleaning up a little bit. Look, the information that he gave us in regards to butter and ghee and beef tallow,
yeah, you can make small, changes. I
that's
mean, you can.
easy. That's easy to do.
Yeah, but
I
I'm not
think we
gonna.
all look pretty damn good for our ages, guys. I
Yeah,
think we do.
I'm gonna have cheeseburgers. I'm gonna have
It's
a
okay.
steak.
Mel,
I'm gonna
it's
do that.
okay. It's
Honey,
okay.
you
I have a
guys
belt,
see.
but Peg is going like, "Wow, I'm dropping everything." It's like, it's like,
Yeah, but
Now
you know what
listen,
though? Wait a minute. That's not fair because you guys, you got good health, blood pressure. There's something going on in my system in the last couple of years that is really out of whack. I'm healthy. I've always been really, really healthy. So and I don't, here's the thing. The number one killer, you guys, in America for women is a heart attack. They call it the silent killer. I don't want to be one of those
but
statistics.
Peg, listen, what he's
Yes,
saying, and I'm going to agree with Mel. If he wants to eat a cheeseburger and all of that, that's him.
that's
You've got
him.
you've got your lane. He's in
Right.
his lane, but he wants to be able to enjoy eating a cheeseburger when you're present without you getting on his case.
Oh,
That's basically.
you guys, I would never do that. He can eat whatever. You guys, trust me. The man eats the way he wants to eat, and I eat the way that I want to eat. He eats, he's very clean. Mel, you eat really, really clean. You really do, and that's why you look the way that you look at 67. And when
yeah,
he cooks,
I try
he
to eat as
cooks with
clean
a
as I
pound of
can.
butter. It's
Yeah,
crazy.
I try to eat as clean as I can, and like the doctor said, make the incremental changes,
Right.
and you'll do fine. Some things you're just not going to give up. I mean, if
No,
I
you have
don't drink a
to.
lot, but if I
Yeah,
want a glass of wine, I'm gonna have a glass of wine. If I want a grilled steak, I'm gonna grill steak.
You have to
right.
I
do
don't
what
have it all
makes
the
you
time, but
feel
I like
good.
having it.
That's
Yeah, it's
fine.
fine. You got to live the life you want to do it the best, and that's how. I mean, no one's going to judge you, and don't
Look.
feel you shouldn't have to feel guilty.
I
You
learned
know,
so much tonight from him, and I'm super excited. There's like little tweaks that we can do. And this whole preconceived idea that oil is better than butter, which is, you look,
well,
as
what he
we
was
go along, and we learn, you guys, we learn things. Look, 20 years ago, this was good for you. 20 years now is bad for you, and vice versa.
I
So
think
everything is evolving and changing as we grow as a human race.
I think what he was saying was not necessarily oil is better than butter, but if you don't know where the olive oil is coming from, then butter is better
Well,
than.
if it's not 100% olive oil, and
Yes,
but this is what he said too. As soon as it's in the bottle, it starts to oxidize. So oxidization is not good, and I've never learned that before, you
that's
guys,
interesting.
ever.
Yeah, I didn't know that either.
Never. Yeah. But it makes sense because what happens to anything that's oxidized? It starts to rot. Anything that oxidization gets into, it starts to oxidize, right? Metal is, so same thing within our
Yeah,
internal body is what he is saying. So anyway,
it's very interesting. I've
Yeah,
never
just
done
do it.
butter.
Just do a little bit better each day, right? Just do a little
amen.
bit better each day.
Amen.
Go exercise a little more, eat better a little bit, right? Get more sleep, get less stress.
Honey,
So there you
I have
go.
to boil and steam my food.
Yeah,
I was kind of glad we called it that.
You can do it. You know what we'll get? We'll get one of those. What do they call it? The pots, the steam pots. What are they called?
pressure
Ste-
cookers.
I'm getting. Oh,
Steamers,
yeah, the
pressure.
steam. I'm gonna get that for you for Valentine's. So when you cook, you can cook that for me.
Yeah, I can't wait.
Well, this is going to be very interesting. I did learn stuff. I so did. So, well, he'll be on some more. He loves this. This is what
Stop eating altogether. She said, "Stop eating altogether, Peg." I swear to God, right? Exactly. I know, you guys. So
Yeah,
anyway,
I'm not. I'm not going overboard. I like eating.
you
I like
don't
to
have
taste.
to. You don't have
I
to. You
like
guys are
all of
in
that.
great.
I
All
like
right.
all of that. So,
Instapot. It's called Instapot. All right. Well, great, you
Mel, you're
guys.
ahead of the game a lot more than most
and
people.
here's another thing that we didn't ask him though. If you your caloric intake is lower as well,
Yeah,
right?
That's
we
true.
didn't ask
You
that.
have to not.
If it's not if you bring it down to like 1,000 or 1,200, that's also good for your health.
Well, he'll be
He-
back. He'll come on anytime. All I got to do is he and I used to do a show together. I just
thanks,
love this.
Vic.
He's so smart.
He's so
Yeah, yeah.
smart. He's really, really
I
smart.
told
And
you. He,
here's the thing, but he has not only is he really smart, but he's practicing cardiologist, so he's got a lot of experience under his belt. And that's what I
Well, yeah.
love.
He
I
sees it. He sees the issues every day too.
Well, I send
Exactly.
patients to him and he gets them all off their medicines. That's
That's
his
me.
goal is to get them all off their medicines. They come back super healthy. It's just insane. He's so preventive, unlike a lot of doctors that just slap medicine. They
Right.
just
The
prescribe
Band-Aid.
medicine.
Right. The
But
Well,
Band-Aid.
he'll come back
we
on.
all. That's a perfect world because he's living in a perfect world. He's got the perfection down because he's a doctor and he's living it. But most people are not going to live a perfect life.
Right.
I like chips too. I like mixed nuts and I like
Oh,
grilled
he loves
steak.
nuts. He says he can eat nuts all day long. He
No,
loves
Oh,
nuts.
did
I
he?
love that
Oh,
stuff.
good. Oh, I love nuts. Love
Nuts,
nuts.
cheese, yogurts, eggs, all that stuff.
All
Yeah.
right. Okay, cool.
All
Yeah.
right, guys, that was
Guys,
fun.
yay.
All right.
Thank
Second,
you,
I'm gonna call you.
Terry. Terry, thank you so
Yeah.
very much.
Terry. Thank you.
Yeah,
Thank
he'll be
you.
back.
He'll be back.
Yeah.
We have a Mel's going to bring a guest on, right? What
Yeah.
guest are you?
I'm gonna try to bring a friend of mine. He's a neurosurgeon. He's actually a
Neurosurgeon.
real brain surgeon.
Is he
I
married?
asked him, and my friend who lives in Houston, Terry, I went to school with. He's a doctor. He's a plastic surgeon. He told me he will come on. Dr. Kevin Smith.
I think I know who he is. That's perfect.
Oh, you
Yeah.
do know. Yeah, that's what you said before. And I'm going to
Yeah.
bring on my hormonal specialist female doctor. She's
And
going to
I
be
know a
on.
really good dentist that'll come on.
Yeah. We need one of those too.
Me.
That's right.
All right, you guys. Thanks,
This
you
was
Okay.
guys.
this was
Bye
so
bye.
good. All
So
Thanks,
right, good
guys.
good.
night.
Appreciate it.
All right. Bye,
Gotta
you
go eat my
guys.
boiled eggs.
All
Bye.
right. And
Bye,
your
guys.
popcorn. Bye.
Bye.